Hi there, I'm Jerry Shih. I am a neurologist here at Mayo Clinic, Florida. I am director of the Comprehensive Epilepsy Program at Mayo Clinic, Florida. And I'd like to talk with you today a little bit about some of the newer treatment options that we have for patients with seizures and epilepsy. Epilepsy is a condition in which people have continuing or recurrent seizures, even unprovoked. And so epilepsy is much more of a medical problem rather than a single seizure. Epilepsy strikes about anywhere from 1 to 3% of the population. So about 1 to 3 of every 100 people that you walk into in the mall probably has a diagnosis of epilepsy or recurrent seizures. About 2/3 of all patients diagnosed with seizure disorder or epilepsy are very effectively treated and totally controlled on standard seizure medications. That's the good news. Unfortunately, that leaves about 1 out of 3 patients with epilepsy who don't have their seizures adequately controlled despite trying a number of good seizure medications and being on the best medical regimen available. For those patients, other treatment options are needed in order to hopefully cure them of the seizures and allow them the ability to lead a relatively normal life. Some of those treatment options include epilepsy surgery, which is standard epilepsy surgery involving removal of portions of the brain from which the seizures come from. Mayo Clinic is at the forefront in terms of looking for new ways to make people seizure-free. One of the newest techniques that we are looking into is a technique called thermal ablation using laser. It is actually not a new technique. It is a technique which has been approved by the U.S. Food and Drug Administration for destroying certain types of tissue that are abnormal in the human body. It's been used in tumors involving the liver. It's been used in tumors involving the kidney. But until recently, it hasn't really been used in the brain. Over the last year and a half or so, a number of centers in the United States, including Mayo Clinic, Florida, have adopted this technique as something to potentially advance our treatment for epilepsy in the patient population that we have. One of the main advantages of this laser thermal ablation technique is the fact that even though we are able to destroy the epileptic tissue in the brain, we're doing it in a minimally invasive fashion. Standard epilepsy surgery involves removing temporarily a portion of the skull so that the surgeon can access the brain and the epileptic tissue in order to remove it. With laser thermal ablation, there is no removal of the skull. A small hole is drilled into the skull, and then the catheter is then introduced through that small hole and directly into the epileptic tissue. And from there, as you heard me say before, that area can then be destroyed using heat therapy, or this laser thermal ablation therapy. My hope is that one day this technique of laser thermal ablation will become standard of care, just like medicines are, just like standard epilepsy surgery is today. But we are not at that stage yet, and much more information needs to be obtained. If you are interested in looking further into this technique for you or a loved one, please feel free to contact the Department of Neurology at Mayo Clinic for further information.